Now, the UK is not the only country in Europe seeing a rise in cases. France and Spain's numbers have moved. Italy too, though to a lesser degree. And in Spain, just as in the UK, officials are connecting the rise with young people not following the rules. In August, Spain's finance minister and government spokesperson sent a warning to people who are younger because some of the outbreaks are linked to the behaviour in nightlife venues or places where a large number of people gather. Well, Alison Galvani is a professor of epidemiology who heads up Yale's Centre for Infectious Disease Modelling and Analysis, and she's live with us now. Thank you very much indeed for your time. Can we speak definitively about the fact that young people are capable of not just catching the virus, but driving its spread elsewhere in the population?
Yes, the pattern of spread from young to the more vulnerable older age classes, as you mentioned, being observed in France and Spain, and has also been observed in the hardest hit American states, and appears to be driving the second wave in the UK, is consistent with dynamics that we have identified on the silent transmission of COVID-19. So an unusual aspect of COVID-19 is that the peak of infectiousness occurs during the pre-symptomatic phase. By translating data on viral shedding, symptom onset, and age-specific mixing patterns, we determined the contribution of silent transmission to COVID-19 spread in and between different age cohorts. We found that the majority of transmission is attributable to people who are not exhibiting symptoms from a combination of the pre-symptomatic stage and from infections that remain asymptomatic. So not only are people infectious when they are not symptomatic, the pre-symptomatic phase is actually when they are most infectious. So most people who are transmitting the virus are doing so inadvertently without even realizing that they are sick. For example, younger people, and in particular younger people, are at lower risk of serious COVID outcomes, but are disproportionately responsible for symptomless transmission. And we see a comparable pattern with influenza, which is spread through similar routes of transmission.
And did that statement that I read from the Spanish government connecting the behaviour of young people and how they congregate with the rise in the number of cases among that age group, did that ring true for you in your studies of other countries and other communities?
Yes, absolutely. So it's a combination of the mixing patterns, which if young people are gathering in clubs or parties, then that will exacerbate transmission. And then on top of it, they're more likely to be asymptomatic or have very mild symptoms, and so will not modulate their behavior through the realization that they're sick.
Professor Galvani, we're going to leave it there, but thank you very much for your time. Perhaps we can get you back on the programme very soon. That's Alison Galvani from the Centre for Infectious Disease Modelling and Analysis at Yale University.